The U.S. Supreme Court upheld a key provision of the Affordable Care Act with direct effects on Arizona.
Pretty close to 500,000 people in Arizona are getting covered in some way by the Affordable Care Act, and those over 200,000 don't need to worry about their premiums spinning out of control or spiking in any way because of an adverse ruling.
The court also upheld same-sex marriage.
We still have a lot of work to do to reach true equality. Women still make less than men. They're still, we just had the Charleston situation.
Arizona still awaits a decision on how its congressional districts are drawn. This is Arizona Week. Hello and welcome to Arizona Week. I'm Christopher Conover in for Lorraine Rivera. The U.S. Supreme Court ruled on two major cases this week, the Affordable Care Act and same-sex marriage. We begin our discussion on the Affordable Care Act. The court ruled the subsidies for federal insurance marketplaces in Arizona and 33 other states are legal. We have two diverging points of view. First, Jane Orient, who is a Tucson physician and the executive director of the Association of American Physicians and Surgeon. She opposes the Affordable Care Act. Jane, obviously not a fan of this week's decision. Let's start with the decision. What's wrong with it?
The main thing that's wrong with the decision is it repeals the rule of law, and it really has the Supreme Court of the United States saying that the law does not mean what it says. It means what they would like it to mean. They would do practically anything, it appears, to preserve President Obama's signature law, even if it means saying things like established by the state means the same thing as not established by the state.
You wrote an editorial recently that came up with some other ideas, if you will, how to solve the uninsured problem, but is not the Affordable Care Act. You talked about a voluntary and constitutional solution. Talk a little bit more about that, if you will.
Well, first, we don't like to call it the Affordable Care Act because it is the Unaffordable Care Act. What it has done is make insurance much more expensive than it was before and solidify in place a lot of things that are wrong with American medical care. And the problem is not that there are people who are uninsured so much, is that the costs are much too high and much higher than they need to be, because a lot of the healthcare system is really about shuffling money around and having people who are just calculating risk algorithms and collecting money, and probably only 40% goes into things you would identify as any type of medical good or services.
You mentioned in there, in some ways, insurance is a gamble, and it's a gamble you hope you never have to cash in, but it is a gamble.
Well, with your car insurance or your homeowner's insurance, it is. You hope that you never have a crash or that your house never catches fire. But with so-called health insurance, it's really a health plan. It's prepayment for consumption. You turn all of your money over to a big collective pot, and you hope that that managed care company is going to dole out something to you at the time when you need it.
How do we solve, if the court had struck this down, how do we solve the problem of folks who don't have some sort of medical coverage and can't afford out-of-pocket payments? Is there a way to solve that?
Of course, if you can't afford to pay a reasonable price for medical care, you cannot afford to pay 2 to 3 times as much to funnel that money through an insurance company. And the one thing that the subsidies did or do is to disguise the unaffordability of the premiums by making somebody else pay for them. So if you make less than a certain amount of money, then other people pay the insurance company, not you. But if you make more than that amount of money, you pay the full load for these premiums, and your taxes have to subsidize people who make a little bit less than you.
This has been a long-running argument before President Obama even brought this up a number of years ago. It seems access to health care is a long-running argument in this country and really probably around the world. Is there a silver bullet to that? Obviously, you don't think this is the silver bullet, but is there a silver bullet to it?
I think that we need a free market and we need charity, local charity, that I think access to medical care in this country is much better than access in most other countries. If you go to the emergency room, you're not seeing well-off people there. You're seeing everybody there and everybody gets treatment. The big problem is that if they have any money, they're going to face a big bill afterwards. But people are not blocked for medical care because like in Canada, they don't have nearly enough doctors, or because they're 3 or 4 years down on the waiting list.
Is there anything good as we've gone through this law from the day it was written to the day it was passed to this week's Supreme Court ruling? Is there anything good in there, or do we really need to scrap it and just start all over again?
Well, I think we need to repeal it and start over again, but there is one good thing in that. That is that if you belong to a health sharing ministry, which is not insurance, but you send money each month to somebody who has a medical need, you are not socked with the individual, what do they call it, responsibility payment or tax or penalty, whatever you want to call it.
So helping people out in addition to just yourself mailing or sending money out helps out.
Correct. And then if you're paying directly at the time of service, the prices are much lower. For example, they can be 1/10 of what you might be forced to pay at a so-called nonprofit hospital if you go to a place like the Surgery Center of Oklahoma that posts its prices, its complete package price for whatever surgery you need to have.
You read the decision, obviously, and have followed this closely for many years. What do you think the future will bring for this law? I have a feeling this is not necessarily the end of the challenges, but what do you see the future bringing on this?
Well, I think it's not the end of the challenges because the law is unaffordable, it's unsustainable, it is making many medical practices close their doors because of the huge additional administrative costs. It's giving people an insurance card for insurance that they can't really use because they're getting very high deductible insurance at first dollar coverage prices, which is just upside down and backwards.
Do you see Congress ever being able to get through changes right now, or are we going to have to wait for a new president or maybe 2 new presidents, depending on how the 2016 election works out?
I think maybe we need to not depend on Congress. I think Congress is quite corrupt and owned by special interest groups, mainly the insurance companies who are forcing people to buy a product they otherwise wouldn't buy. I think we need to look at places like medicalselfsufficiency.com and find out that being uninsured is not necessarily all that bad. There are ways to take care of your needs without wasting 60% of it on third-party payment.
All right, well, thanks for coming in and talking with us about this.
Thank you for the opportunity.
Now Matt Hines. He's a Tucson Medical Center emergency room physician and a former state lawmaker. He's also a supporter of the Affordable Care Act. Matt, let's start with what this ruling on the Affordable Care Act means to Arizona. A lot of people got to keep their insurance as a result.
That's exactly right. And this is it's a fantastic decision for people in the state. Over 200,000 here in Arizona have health care through the marketplace that serves Arizona, and another 270,000 approximately through expanded Medicaid. So that's pretty close to 500,000 people in Arizona are getting covered in some way by the Affordable Care Act. And those over 200,000 don't need to worry about their premiums spinning out of control or spiking in any way because of an adverse ruling.
You're an MD here in Tucson. Tell me about your experience. You work in a hospital, you're not in a private practice, but tell me about your experience with the Affordable Care Act.
So it's, we are all, and our health professionals are all working hard, nurses, doctors, pharmacists, just to really take care of patients. That's what our focus is. And something that we have seen that over the past couple of years, after January of 2014, a lot fewer people are coming through the door with an inability to pay, meaning uncompensated care is plummeting across the state. You can see that. The Arizona Hospitals and Healthcare Association put out some pretty clear facts and figures about that, but it's dropped by over 50%. So that means people are getting insurance, they're able to come in and they're able to see, if they need to, a physician or a nurse practitioner to get the care that they need. And so families are now able to get access to care affordably and at the right time when it's easier to take care of some of their problems.
Before you returned to Tucson as an MD, you were working for the federal government talking about the Affordable Care Act.
Right.
Did you hear the narrative change at all while you were doing that? And did you hear opinion change at all? Or is it still very black and white how people feel out in the field, not necessarily the political pundits?
Yeah, I think my role for the federal government was to work really closely with health professionals on behalf of the Secretary of Health and Human Services to engage the community and help them figure out the Affordable Care Act. It's complicated. But really, as over the almost 2 years I was there, the first enrollment cycle, for example, a lot more resistance, and the second, just a lot more familiarity. People were starting to get used to it. What is this website thing, this healthcare.gov, and people had explored it, whether they actually engaged and enrolled or not. They were familiar with it. They'd seen it in the news. They'd seen it on maybe Colbert or unfortunately sometimes some of those shows. But that made it easier the second time around, and that the same thing applies to physicians and other health professionals. We get more familiar with something and are more comfortable with it. And frankly, it's just human nature to be somewhat apprehensive and fearful of something that is complicated and relatively unknown territory. So that it's much easier for people to, I think, deal with now and understand, and they see how it's working for their neighbors and friends and themselves.
Let's take ourselves back a little bit earlier in the week to the ruling. If the court had ruled against this provision of the Affordable Care Act, what do you see happening in Arizona if we'd had the opposite result?
It would have been potentially just chaos for especially those 200,000 that are on the marketplace, that are getting a private health insurance plan through the Affordable Care Act here in Arizona, because there was really no fallback. The governor and the legislature, I think rather unwisely, passed some legislation this past session saying we will absolutely not set up a state exchange to help these 200,000 people have a sustainable marketplace. And that could have caused all of the premiums for those folks to go out of control when all of a sudden those tax credits for low and middle income folks would suddenly disappear. So it was never something the administration thought was truly going to happen. And frankly, when I was there, it was not something we were ever even preparing for, but it would have been absolutely disastrous.
Having looked at this through the eyes of a doctor who deals with it on the ground, and also through the eyes of the Secretary's office and the administration, do you see things within the Affordable Care Act that you look and say, well, that could be done a little bit better, or is it about as good as it can get?
Yeah, we can always do better. I think that's something you'll hear from Secretary Burwell and from the President himself. We really can. But is it something that, as a physician, I see patients able to come in and afford to get care they need at a time when they need it? Yes. That's something that all of us in healthcare are seeing more and more and more. And that's really what it's about. It's making sure patients and their families get the access to care that they need at a time when they need it.
Working in a hospital, working in an ER, do you see less emergency room, family physician type visits now than you used to, or do you still see people coming through the ER doors for what are not emergencies?
There's going to be a degree of that always. It's unfortunately a lot of folks who were unable to get afford and get some type of insurance before. Things would just get out of control. Okay, this won't stop bleeding, or nope, grandma's really too blue now to put this off. We've got to go to the ER, or the chest pain really won't go away. And so that's where a lot of folks were used to going. And now that they have insurance, one of the main goals actually for HHS at the time, and I know it still is to help people figure out what does it mean to have insurance. Here's your primary care provider. This is your medical home, and to really to educate patients who previously were not able to get insurance, and everyone, about the best way to access that care, and frankly the most cost-effective way and better way for them to do it for their own health.
All right. Well, Matt Hines, thanks so much for coming in and talking with us about the Affordable Care Act through your eyes.
Certainly. Great to be here.
The Supreme Court ended the week by legalizing same-sex marriage, but did not rule on the state's redistricting case. We begin our discussion of those two cases with Bill Beard, the chairman of the Pima County Republican Party. Let's start with today's ruling on the same-sex marriage. It reaffirms what had already happened in Arizona from a court ruling a couple of months ago, but now it's legal all over the land.
The bottom line is that the Supreme Court is the authority on that, the ruling, and you can like or dislike what it is. There are things that Supreme Courts have handed down over the years that either personally or from a party perspective we haven't exactly agreed with, but we firmly believe that what the Supreme Court says, that is the law of the land, and it is up to the legislators and the governors across the country to implement that law.
Let's move to what we will assume is a ruling coming Monday, the redistricting case for Arizona. The question being, are Arizona's congressional districts correctly written or correctly drawn by the body? What happens come Monday if the court rules that Arizona's congressional districts are no good?
Well, a lesson to remember in this conversation, this isn't a legislative issue. This is an issue that about what the Constitution of the United States actually says in it. And it's pretty clear to the average person reading. It says the state legislators are the ones that are responsible for determining the lines for determining congressional districts. That's pretty clear. I don't care what side of the political spectrum you come down on, that language is pretty clear. Everything that I've seen reported in folks that really follow this stuff, it's basically probably going to come down to the Supreme Court saying, yes, indeed, it is up to the legislators across the country to determine what those lines are. And in essence, say to the Independent Redistricting Commission, you no longer have the authority to draw those lines. It will be interesting to see what the various sides do as a result from that. The popcorn concession should be quite entertaining for most folks, but I think the bottom line is, if you really truly believe that you want to have people that are elected to office are the ones that are held accountable. You want the legislator to be the ones to draw those lines, because right now the Independent Redistricting Commission, they are not responsible to anyone but themselves.
We have two districts of particular note in Arizona, District 2, Martha McSally's district, and the district in the Phoenix area, Kirsten Sinema's district, that are very, very competitive districts. McSally only won by 167 votes. Will those districts, do you think, drastically change? Is there any way you could change those to make them, you could certainly make them less competitive, but will they ever be a safe district?
Well, I think anytime you start to draw lines, anybody that understands, how the process works, there are a number of factors that go into it. You've got populations of interest, you've got geography, lots of things that go into determining where the lines are drawn. And whenever you start drawing a line in one location, you start determining where the corresponding other lines are going to be across whatever that district is determined. I think for most folks that live in the state of Arizona, you will see a congressional, as an exercise for the intellect, it's going to come down to more representation for Republicans than Democrats, simply as a matter of that's where the majority of the voters in Arizona happen to be. The computers can draw the lines in a lot of different ways, in a lot of different configurations, but I think you'll see, for the most part, the new lines, assuming the Supreme Court hands down the decision we expect, you're going to see lines that are more in line with where the folks live in the various parts of the state, and carve up those areas more representative to reflect what it is the population of Arizona actually is.
If the lines are ordered to be redrawn, is it realistic to think court cases being what they will be if they do get redrawn, that these districts would go into effect for the 2016 election, or realistically would these be a 2018 change?
If you look back at what has happened in the last two times we did redistricting following a normal census, there were court cases of various types, But for the most part, even in 2014, when those lines were drawn, they were drawn very late in the cycle. And I believe it was the Secretary of State that had to make a determination that if you had already filed for office, you could gather signatures in both the old configuration of that district and the new. I would expect, given that precedent, that the Secretary of State would do something similar in terms of, if you're gathering signatures for office, assuming they were to draw new lines later this summer, that would still give plenty of time for anyone running for any of those districts for Congress to gather enough signatures in the appropriate areas to get on the ballot.
With about a minute to go, how hard is it, with all of this looming out there, to recruit candidates?
It's funny, as chairman of the Republican Party in Pima County, the opportunities for Republicans in any office are, frankly, it's fertile ground for many folks that are out there. It does come down when you're making the decision to run for office. It's not just a personal decision for you yourself. It involves the family. It involves your personal finances. It involves your job. All of those things go into the process of figuring it out. But ultimately, if you're thinking in terms of Republicans versus Democrats, the ground in southern Arizona, we've got fertile field, and the horizons are very optimistic for all of our candidates.
All right, well, thanks for sitting down with us and talking about all this. And now here's Cheryl Cage, the chair of the Pima County Democratic Party. Cheryl, let's start with today's ruling out of the Supreme Court on same-sex marriage. Affirms what had already happened here in Arizona, same-sex marriage legal everywhere.
It has been truly a remarkable week. I think we are seeing this wonderful trend of inclusiveness. Obamacare is now the true law of the land. It's a right, not a privilege, to have medical care. And now, it sounds corny, but love has won out. And I think today is a remarkable day, and I just couldn't be more excited about it.
And as we said, Arizona, this had already become the law in Arizona a couple of months ago, but now it does affirm it nationwide. So off we go.
Off we go. And we still have a lot of work to do to reach true equality. Women still make less than men. They're still, we just had the Charleston situation, but we're moving in the right direction, and it feels very, very hopeful.
Let's look forward to Monday, the case Arizona has been waiting for weeks. We've all been getting up early to see if the court rules, and that's the Arizona redistricting case.
Right.
Will Arizona's congressional lines be found constitutional because they were drawn by the Independent Redistricting Commission, not the legislature? Monday morning, we should get a ruling. Mm-hmm. What happens from your perspective if the ruling goes in favor of the legislature and we have to redraw these lines possibly before 2016?
Well, I think it's important first, before you answer how we'll approach that, with looking at it in a broad context. And I think this week is a perfect example of the fact that the Republican Party is running scared. There is a changing view in America. We're going towards a majority minority. Young people are saying we want inclusiveness, and instead of changing their politics, because the Republican Party has been against everything that passed from SCOTUS this week. They were against gay marriage. They've been against Obamacare. This redistricting case is really kind of their last attempt at a power grab to stay in power. And I don't know what will happen. We were talking before, in Arizona, you just don't know which way things are going to go. But I do know that whatever the decision is, we will fight for equality and for justice. And, the voters in 2000 said very clearly, we don't like the gerrymandering that's going on. And they passed Proposition 106, which changed our Constitution. And we have competitive districts, much more so than we did before. And I think that it's also important to understand that it seems like the term legislative is going to be a big turning point with this decision. But it's also important for people to understand that the legislature was not cut out of this process. The 5 members on the commission, 2 of them are Republicans, 2 of them are Democrats, and those are selected by the legislators. And then the 5th person is selected by those 4 people. So the legislature does still have some input, a great deal of input into this. So I will be very disappointed if it goes against the commission, and I would suspect that we will fight it if it does.
You mentioned competitive districts. In southern Arizona, we have the district that is now represented by Martha McSally, very competitive. In the Phoenix area, we have the district represented by Representative Kyrsten Sinema, very competitive. Do you see a way realistically, because everything has to fit together, it's a big puzzle, that those districts become safe districts, or will those always be competitive districts? It's just how competitive?
You know, this is where the cynic in me comes out, because I think we all know that the Republicans in the state legislature have already started drawing the maps. They've already put some money down on people to help them to draw those maps. The reason that they're doing this is because they don't want competitive districts. You know, I love the fact that you know, I'm disappointed that Ron Barber lost, obviously, but the fact that he lost by 167 votes tells me that's a really competitive district, and I like that. I like our politicians to have to stand up and say, "This is who I am. This is what I'm going to fight for," and that's what you get in a district that is truly competitive. And my fear is that they are going to redraw the lines to where there are more Republican safe districts, and you will see people gaining these seats that perhaps are not the best people to have. I know there's been lots of talk, I'm not saying anything that you don't already know, that David Gowan is looking for a congressional district. And this is a politician that, quite frankly, I'm sure he's a lovely man, but he's tone deaf. You know, he cuts JTED, and then he uses the JTED students to fix his car and save between $700 and $1,000 and doesn't see anything wrong with that. That's not competitive candidates.
All right, well, thanks for coming in and talking with us about this. We will all wait for Monday morning to see what the Supreme Court rules.
I'll be up early if you need to call me.
Thank you.
Thank you.
And that is our program for this week. We're off next week in honor of July 4th. Thanks for watching. I'm Christopher Conover.